Hey, this Realm of the Mist podcast is brought to you proudly by the Nurses Guild.
Hi, this is Eddie Deason. You're listening to Breaking the Fourth Wall. I was Mandark in Dexter's laboratory. Ha 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 ha.
Hey, what's up, guys? Christopher Stolle back for another Breaking the Fourth Wall, and I'm extremely proud to sit down and talk to these ladies today. They are the vice president, co-founder, and a registered nurse, as well as director of nursing and registered nurse for the Nurses Guild, our proud new sponsor. Ladies and gentlemen, please allow me to introduce to you Mrs. Lee Phillips and Gretchen Berkhorst.
Yes. Good morning, Chris. How are you?
I'm great. Thanks for joining us today. I know you guys, ladies, are busy, so I won't keep you too long, but I definitely wanted to break down, because not only are you a proud sponsor of Breaking the Fourth Wall and Realm of the Mist Entertainment, but because I am helping to promote your business in the sponsorship, I want to be able to dig deeper and really give the listeners a chance to know what it is your service provides. So why don't we go ahead and start off with simply, what is the Nurses Guild?
Well, we started this company in 2006, and my husband and I, he's a critical care nurse and I'm a psychiatric nurse.
Okay.
And we were, started getting a lot of patients. And we decided, we need to do this on our own. We can get more money to the bedside, take care of the patients better, and start our own thing and bring our own friends instead of working for somebody else. So I brought my friends, and Gretchen's a very good friend.
And more, and other friends.
Yeah, and she's a fellow psych nurse. And we ended up, starting the Nurses Guild, and then we ended up having two offices, one in Lighthouse Point, Broward County, and the other in Palm Beach, Boca, where that's where we are today.
Okay.
We're in the office. And we provide a lot of care, home care to patients. Patients don't want to go to the hospital. They'd rather stay in their home. And we try to provide therapy, physical therapy, occupational therapy, nursing care, IVs, and psychiatric care. And our agency is different from others because we do provide psychiatric care. And well, that was our specialty.
Right.
Pretty much. So
yes.
we really try, because in the pandemic right now, people really need us. They really need the support, because at this point in time, because of the COVID era, most people don't want to go to the ER. And some people are actually dying because they're not going to the ER because they might have a cardiac event happening, but they're choosing to postpone it because of COVID. They don't want to get infected in the ER. So that's why home care is super necessary. So they can have the kind of treatment that they need, and they can get it done at home, or if they absolutely have to go to the ER, then that can be done as well, without running that risk. People are scared, and sometimes they'll call here, they'll call our office, or they call us, because we get to know our patients personally. We have family members. We have this one family member that we feel like she's our family. I mean, she takes care of her husband who's really critically ill, and she does so much. And we try to support her as much as we can. We try to send her a nurse to help. We try to send her supplies. We do what we can. But we get very involved, and it's probably because we've been very involved with our patients. We try to give them whatever we can. So that's pretty much what the Nurses Guild is about. It's about the patient and the care and the family. They're the most important things. And most of our patients have relationships with their nurse, and they'll ask for a certain nurse. I had an admission yesterday who the hospital wrote, "We want this nurse," and they had her name. And people get connected.
to their caregiver.
Well, it does raise a couple questions that I had maybe to help clear up for the listeners and also for myself here. When we talk about at-home care, especially for some of the services you provide, we're not just talking about like the elderly or somebody with a physical disability in the sense of like, you know, a disabled veteran, for an example. But your service also offers to people who are and correct me if I'm wrong here, okay? I'm going to use broad generalization because I'm not a doctor. So specific ailments or disabilities are far beyond my comprehension. So as a broader spectrum, like you'll help people who are severely autistic, for example, or maybe with Down syndrome that can't necessarily live on their own or take care of their own physical well-beings or mental well-beings. Is that correct? The Nurses Guild is broader than just elderly healthcare.
We basically do elderly healthcare. A lot of patients like that. Some of them do have Medicare because they're disabled.
Okay.
Some younger patients. Some of our psychiatric patients, especially like in the Broward area, we have a lot of psychiatric patients that maybe aren't elderly and maybe they're getting injections or something like that. A lot of them will have, you know, a Medicare plan because they're on disability. And we see a lot of those patients. We don't see like pediatric patients.
Right.
We're not qualified to do that.
But there is, in addition, there's a private side
Right.
as well.
Right.
So there might be non-professional services provided in assistance. And that could be that's private pay and out of pocket as well. So there is that homemaker, companion type of home health aid type of service as well. And that one is generally paid out of pocket. But Medicare does provide home health aid for the seniors as well, or for anyone who's disabled.
For a certain length of time.
Yeah, it's short term.
Yeah, everything right now with home care is short term. It used to be more long term, but now what basically Medicare is a short term process. And a lot of times hospice would be picking up some of these patients. But now people are starting to look at that and say, you know, you can't be on hospice for 2-3 years.
Right.
You're better off having, you know, home care. And that's the thing, like home care is starting to move away from chronic care. But in Florida, we have a lot of chronic care. I mean, a lot of people come down here. Their families are down here, they retire down here, and somebody needs to care for these chronic people. And pretty much home care needs to try to get back involved in that method, because now we're doing like more acute, where we see them for like, I don't know, 2 months or something like that, instead of like a year.
See, that's something that concerns me, and maybe my lack of knowledge of education in this might cause some of the ignorance in the question I'm about to ask. But you say with the short-term healthcare, and just so I can center to my own brain or put the math together in my own brain, for the sake of argument, let's say short-term healthcare is 90 days. So the people on Medicare or Medicaid can get 90 days of your service. And then afterwards, what? Pay out of pocket, go to another group, or can they recycle and pay for another 90 days of your service? Like, how does the short term work if somebody needs it more than what the short term, allows?
What you might be thinking about is a chronic care patient or someone who has a chronic condition, like a disability, like quadriplegia, that individual might have a catheter or some other medical device that has to be maintained because of his bedbound status and inability to move. And that individual, he or she, may be at risk of now skin care because their wounds, and which can arise because patients begin to have difficulty with movement and pressure. So It's difficult because they're not, Medicare is not providing a program really that is really fixed. They will allow it, but they're not really fixed on providing a program that's really for long-term chronic care.
They want us to train family members.
Yeah.
To do things like wounds, dressing, stuff like that. And some family members are able to do that, or to teach the patient. Now, there's only so much you can do with teaching some of the patients.
Right.
A lot of our patients have dementia. So I can't expect them to know how to do their 20 medications. So maybe what I do is I try to contact their neighbor or their family member, or if they have somebody that lives in, because not everybody could afford, an aide to help them or whatever. We try to give them as much as we can. And if we see that there's a need, a big need, we'll call a social worker in too to help, to see if
there's some community resources that this person is eligible to get for assistance. But the big crux of the matter here is people that don't have someone looking in on them periodically that are really chronic care end up in the hospital way more frequently. Big expensive bills in the hospital. So home care is a win-win if the government really begins to look at it more, because the patients prefer it and the emergency rooms prefer it, because the patient can be stabilized better in the home.
And less infections.
Yes.
Because when you're in your own home, okay, you kind of know what's going on, and it's safer for the patients. It's better for like fall prevention because they know they're home. We could send an occupational therapist in and they could set up their home if they're having some disability, if they can't see or whatever. That person evaluates their situation. And really, if you got sick, wouldn't you want to stay in your own home instead of, it's scary going to the hospital.
Well, I was actually gonna state on that. I was thinking when you guys were first talking about you guys especially specialize in psychiatric
yes, in providing, because some people have maybe a diagnosis of agoraphobia as well as a depression. That means the person really doesn't want to leave their home because there's too much anxiety involved.
Well, even not a person like that. I was thinking back to when I was a kid, and I was a disruptive kid. I wound up getting diagnosed with AD&D or ADD.
Everybody gets diagnosed with that when you're a young boy.
They hand out Ritalin like it's attacks. Yes. I mean, at the time, I remember them sending me to a psychotherapist. It's the only time I ever went to a psychotherapist. And, they're trying to figure out why I was disruptive and everything. And the psychotherapist was trying to make me write letters to my dead father, who died when I was 6 months old. So I didn't even have memories or recollections of the man. But, I'm not picking on the process, but I remember even as a kid how uncomfortable I was in their office, in a strange space, and talking about things that you just don't talk to people about. I got to imagine with that field, doing it in the comfort of your own home. Like I'm imagining like now 43-year-old me, if I needed like psychoanalysts talking to me and figuring out what's wrong in my head or whatever, I think I would feel more comfortable sitting in my own recliner talking to you about it than some hospital room or office building room. No matter how many nice pictures they put on the wall, it's not as a comfortable space as my own living room.
And you can control it too. And that's one of the big issues, is people feel that once they have control, or they feel they have control, then they can be more revealing.
They feel more relaxed in their own home. And a lot of us, when we go and visit them, we share with them. We let them talk about what their problems are. We try to give them support. Gretchen and I are both trained in hypnosis. And a lot of the elderly are kind of freaky about it, but we've had patients that actually said, please help me in any way you can. We don't like just pushing drugs on people.
Right.
I mean, I've been a psychiatric nurse forever, and I started when I was very young. And it's very difficult because I thought by now we'd have better things than Prozac. And it drives me nuts.
Right.
You know, because I don't like pushing medication on people.
And benzos are that's another
really
area.
Scary.
Seizures. Benzos are not something that it's still being prescribed quite often. And many people don't respond well to them. And sometimes they continue taking it for way too long.
And they have falls. And what happens is they get a tolerance, so they keep taking more and more. It's dangerous. We evaluate their medications. And like you were talking about the Ritalin, I know the Ritalin days, and a lot of college kids would take it to study. And now like Adderall, and there's so many younger men, young boys, and even older men that they say, oh, they have ADD. They have ADD. I mean, look what you're doing right now. It's pretty cool. You really got to concentrate. You talk to people. You got to, I mean, it's just, it's crazy.
I never believed I had AD&D, and actually Christopher's Hospital, CHOP, Children's Hospital Philadelphia, and all, they evaluated and tested me in 4th grade, and later on discovered that I didn't need Ritalin. It turns out I was just really bored, because I'm already at a high school level with most things, and sitting there teaching 4th grade level to things I already knew. I was disruptive because I was bored. Yeah. There was nothing challenging me. That's what they discovered. But I mean, with the Ritalin, I remember my mother talking about, and this is why I distrust a lot of medications. And maybe you can help ease my mind and some of the listeners' minds that may share the same thing with me. But like with things like Ritalin, for lack of a better term, from my experience, was like speed. It was legal speed.
Right.
And my mother described my behaviors with Ritalin was when I took the pill, of course, I was laser focused on everything I was doing, but I was a drone zombie. Like I would just do what I needed to do, go through the motions, and everything was fine. Like obviously I was concentrating and not being disruptive, but I was also not really a personable human being.
Right.
She said the worst part about it was when I would come off, when I'd start coming down. You would notice I was coming down because all of a sudden I became enraged and angry and very antsy and to the point of not physical violence to people, but like zero tolerance for things not working the way I want them to work right away. So the best way to describe it is getting mad and cursing out the VCR because the tape wasn't rewound.
Yeah, right. You didn't have the energy to manage the emotion, the impulsivity, because you were coming down from that medication, so you were tired. You didn't have really the ability to manage these emotions, and not the coping strategies either. As a young person, you didn't have to develop it.
Plus, sometimes people develop a sleep disturbance. I mean,
that's
true difficulty too. Sleeping. You're trying to sleep.
Again, no resources, no emotional resources to be able to manage.
And then you can get depressed too, especially if it stopped abruptly. And the same thing even with all the new ones. And some of them, they're saying they're good for weight loss and stuff like that. But any kind of medicine that you're on, you really have to look at it and see and find the reason why you're taking it. Because a lot of the medications have side effects.
Right.
Short term may be definitely, because one wants to take the edge off. Sometimes there's a great deal of depression and real psychic pain, and whether it's an older person, in their 20s and 30s, or and there are events in life that are traumatic. People's spouses die, people's children die, all those kinds are truly traumatic, but they're not meant to replace the ability to live. And people need to have coping skills.
Well, that was part of the reason I was leaning towards in that question. Wasn't necessarily about like myself, but it was using myself as an example.
Yes.
When you guys go into a person's home, and of course through the stuff that you do, obviously you got to help manage their medications. Do you guys not only just manage like Monday, Tuesday, Wednesday, Thursday, Friday, but you take a look at each individual medication and see if it's something that they really necessarily even need? Or maybe find out that it's the wrong medication for what they symptomatically have. as opposed to, product B would be better for their individuality. Like, is this some of the home care advices that your company would provide?
There would be the adverse effects of the medication. Say if the patient is talking about, I'm having this effect, or I'm overeating and they're on Depakote, and you see the weight's really going up. That happens to be a medication that really puts on
and
the
their
weight
sugar
for
goes
some
up.
people. Yes, Zyprexa, a medication, blood sugar really goes up. Yes, those are things that we report to the physician. So that the physician then can make an assessment.
And sometimes we know the patient better than they do because we see them more. Because we might be going in there for 2 months, twice a week or once a week. So we see what actually is going on. And if we see something that doesn't look right with their medications, or if they're having a side effect, like Gretchen said, a lot of the psych medicines cause weight gain. They cause increased blood sugar. They cause sleeplessness. Some of them cause too much sleep. So we were able to evaluate that, and the patients feel more comfortable because some of them are afraid. They're like, some of them don't even want to take the medication. And you'll ask them why. And then if it sounds like they have a reason and you think maybe they don't need it, you discuss it with the physician and let them know.
We also do a lot of teaching.
A lot.
Teaching in the areas of breathing techniques, or positive imagery or guided imagery. We start with a little bit of the techniques that we've learned, and we want to be able to show this individual that they can manage their anxiety, that they have much more control over it than they really thought they did. So these practices, as they're called, as a person practices them and does them, becomes more and more proficient at them and can manage more emotional upset or afflictive emotions. That's another part of the strategy that we go in as nurses to instruct on coping skills, practices, evaluation of medication. So there's a number of things that we would do on the psychiatric side.
We look at the whole person.
Mm-hmm.
We look to see, besides their physical, it's really weird when you're a nurse as long as we have been, you can see a person and just walking down the street and kind of know like what their symptoms are, what their conditions are,
I'm going to turn my camera off now.
Okay. Not to scare you, but you do. You look at people, you really evaluate them, and it just gives you a better idea of what's going on. Looking at the person, and the other thing, one of the things I think that's really important about psychiatry is most psych nurses look at the whole person. And we kind of over communicate. We do that a lot, which sometimes it could be annoying, but it's important, especially in home care, because communication's tough. You're out in the field, you're there by yourself, and you can call the office, you can call the doctor, but like if the patient's having a cardiac arrest, I mean, you call 911, you start doing CPR or whatever. Or the other thing, it could be a psychiatric, somebody could be really like losing it. Agitated, not to scare people, but I've had a knife pulled on me, and Gretchen's went to somebody's house and he had guns. But I mean, this is the way things are, and people now, the way society is today, it's very scary. A lot of people are afraid. They're afraid of COVID. They're afraid to leave their home. If they leave their home, are they going to be safe? These people, the elderly especially, were afraid to leave their home in the first place because some of them are worried about them falling or, having some kind of medical problem when they're out there. But now it's a lot more.
Well,
So,
again, you kind of bring me back to one of the first questions I asked with, besides the elderly, I mean, to give you an example, And there was two things I wanted to take away from this. What I'm about to say now, and then I want to get back to the breathing technique because I had a question about that. But beforehand, to give you an example, down in Orlando, Florida, I have a good friend who was an independent professional wrestler with me. He actually owned a company called Rocky Mountain Championship Wrestling. His name is Michael Hunt, but we called him Lightning Blind Mike. And the reason we called him that is because he was blind. He had 20% of his peripheral vision. He could see shadows out of the corner of his eye. That's how he was able to maintain being a professional wrestler. Since those years, his eyesight has gone completely. Now he runs an internet radio program for blind people called blindcaferadio.net.
That's great.
Wonderful.
Wow.
And I was wondering, does the Nurses Guild provide anything for people with that type of disability where they may have problems getting along in life because they have no sight or no hearing?
Yeah, actually there is low vision. They call that low vision because he's not probably, at the time you were talking about, he wasn't completely blind. So low vision,
Yeah,
right.
Occupational therapy.
really sin.
Is a specialty in low vision, and they are able to work with the individual because they need to structure the home in such a way that it's easy to move around.
And that's an important thing. Like my mom, she has macular degeneration.
That's what he had.
Yeah, and she gets, the injections. And it's helping her. I mean, she's 92 years old, and she was driving like 2 years ago. But she, she has difficulty, and they set up her house. A home health person came in, occupational therapy, showed her how things are. She has someone helping her with her medication. Some of them even have, if they don't have help, they have these medication boxes that remind them to do things. It's time for your pill, that kind of thing.
Things like Alexa and Google.
Right, like that kind of. And they also have things they press that if they're, walking around and they fall.
An alert button.
An alert button.
Right.
A lot of them have those medic alert
and
buttons.
Lions Club, I believe, may still have a program where they have it's a magnifier.
My mom has that.
So
they even have one to put on checks.
So you can still, it's a big magnifier, and you can still do your own things so that you can continue to be as independent as possible.
Yeah, we encourage as much independence as we can.
Right.
But if we see someone that needs help, then, we get the social worker involved. And a lot of times social work, people get scared when they say, oh, the social worker's coming. Oh, they're going to take me out of my home. Oh, they're going to put me away. We have to try to convince them that the social worker is
their friend.
Is trying to help them. Just to go in and to see what the situation is. I mean, we see it too, but, we got to kind of work together. We all work as a team. We work with the therapists. We work with the social workers, the aides. The aide will call us and they'll say, Mr. Smith doesn't want to take a bath. And, we're like, okay, well, let's figure out why. And, they might not realize, okay, what's the reason? So they'll call us and they'll say, hey, what should we do? We try to see what we can. We talk to the families, because the families are really important. In home care, families are up there with the patients,
And some dementias do create that situation where they don't want to always do the shower, or they don't want it on somebody else's time, or they, so it's not
Well, now you ladies are going to have me picking your brain off camera, because I've got a 12-year-old daughter that seems to be scared of the shower. There's a psychological reason. But no, the question I had for the breathing exercises that you were talking about are, for layman people like myself and maybe some of our listeners, are we talking like Lamaze, or are we talking more like a meditation? Like what type of breathing are we speaking?
It's more a meditation, but breathing, once you begin to breathe, you can immediately have a response in your anxiety. Once you focus your attention and you slow down your breathing, because what anxiety does, number one, you hold your breath right because of the anxiety. And when you hold your breath, there's a lot of biochemistry in your body that's changing.
Okay.
And a lot, and adrenaline's going through that bloodstream and being pumped through the bloodstream. But once you begin to breathe, if you notice hold your breath with certain thoughts, then you can begin to breathe, and you breathe slowly and you count. One of the easiest things to begin is to do counts. 1, 2, 3, 4, inhale. 1, 2, 3, 4, hold. 1, 2, 3, 4, exhale. And then begin your cycle again. And as you do this, you increase your minutes. You sit, you increase your minutes, and your anxiety will fade.
And repetition and structure really helps people. It helps children. It helps dogs. It helps elderly. When you have a set plan of, like, let's say you're going to do some breathing or meditation, whatever you want to call it,
right,
at a certain time of the day, and you start doing that at that same time, certain times of the day, your system gets used to that.
Yes.
And you incorporate that into your life. And it could be with anything. It doesn't even have to be breathing. It could be exercise. I was a big gym freak from all my life. I've lifted a lot of weights, but since COVID came, I had to quit the gym. And I was like, oh man, what am I going to do? So I started swimming. And so now every day, like, I'm at a desk job, which is kind of hard for me because I'm pretty hyper.
Right.
Every day when I'm done here, I swim laps. And I'm not great at it, but it makes me feel. Music is another thing. I put my music on, I swim my laps every day after work, and it's a routine. People need routines.
Structure helps.
It's really, and,
yes.
and we teach them that.
And outlets, I would imagine, because thinking about like anxiety and anger issues, for myself, the thing I found to help me was being a songwriter. Whenever I ever get pissed off, for lack of a better term, I'd sit down and write a lyric.
Right. You're distracting yourself from the thoughts that are producing the emotion of anger, and you're redirecting your attention to something that brings you pleasure and joy. Right.
That's the way I always looked at it. Is I was taking my aggression out in what I was writing, as opposed to taking it out on a wall or some person I don't want to hurt, or whatever the case may be. And so that's why I always say, like, agreeing with what you ladies are saying, but also finding an outlet for those things also helps, I think.
Yes, that is another technique. That would be a technique, redirection. There's also others where you actually don't redirect.
Okay.
But this might be, I don't know, if you want me to, I'll explain what it is. Okay, make it really down and dirty quick.
All right.
You have a thought, negative thought. It causes you distress because once a thought goes by, you have an emotion that comes up. Anger, frustration, sadness, anxiety, fear. That's an afflictive emotion. When you notice that emotion, say to yourself, welcome, welcome. Welcome, why? You're given the opportunity to actually become conscious to your thinking. You need to sleuth back with that emotion. What was I thinking prior to the emotion? That will bring it to your conscious awareness. So now you're not unconscious about this emotion. And every time you can do that, you're bringing conscious awareness to the afflictive emotion. It gives you the opportunity to transcend that.
You can.
So if I'm understanding this correctly, and so, just for my own head here, my own headspace, if I have a thought, like I'm thinking about my ex-wife and child support, and I get aggressive and angry because of because of it.
Emotion comes up of anger, frustration, yes.
And as opposed to going to an outlet and writing a song about how I hate paying child support, for example, what you're saying is I should say, hey, welcome anger. Let's hash this out and almost become my own psychologist in this fact of like, okay, this is the thought that made me angry. This is anger. Now let's analyze why this makes me angry.
Let me make this point, really refine it.
Yeah.
You're welcoming the opportunity to practice how to let go of this emotion, because if it just comes through, you're unconscious about it. But if you begin to bring it to conscious awareness, you can see, I see that I am angry. Chris, I would even suggest that you use your own name. I see Chris is angry about this. It's a third person perspective.
Okay.
So you can say, I'm not judging. Chris cannot judge himself for having the thought. It's perfectly fine that he feels the frustration.
Okay.
But it must become conscious to you that this is going on in your own mind. And as you become more proficient, Chris can let go of this frustration and anger. Chris can let go of it. Let it, just let it go without pushing it away. It's a passive practice.
Like cognitive behavioral therapy. It lets you realize what's going on with you.
Right.
And how you can accept it and how you could help yourself change. The brain is very plastic. The brain can change, especially somebody like your age.
Quickly.
More than you think.
Things can, once you practice that a lot, it loses its habitual nature because it's habitual.
We're not saying things are easy, but.
No, not at all. But I would imagine this is something you would do in like a mirror. Wouldn't it be? Or literally you sit on the bed and just think.
I mean, you could be doing it in the podcast right now.
You're in your car.
Right. In the comfort of your own mind.
Headset.
So this is...
Damn, they caught me.
So this is going beyond the fourth wall.
Yeah.
This is going deep.
This is a deep wall.
Dive.
I told you this is what I do.
Well, there you go.
There you go.
But
so yes, but it is a practice, and you will be amazed. But you just keep doing it, and as often as you can. No judgment.
Yeah.
Though. No judgment.
And that's hard to do.
Yes.
Because
in the beginning, you'll judge yourself, but let it go.
Yeah.
Let it go. Let it go. Don't push it. Don't push the emotion away. Don't push the thought away. It's a letting go.
I can jump into this rabbit hole all day, but I know you ladies get back to work and all that and all. So I'll save the rest of the questions for another time on that. Quite honestly, just talking to you two ladies, I'm sold on the product. But for people that are listening that might be interested in home health care, especially for their aging family members, disabled veterans, stuff of that nature, obviously down in the description down below, we have the Nurses Guild website, as well as the 2 phone numbers from Palm Beach, and I forget the other place. I don't have it.
Yeah, Lighthouse Point.
Lighthouse Point for you guys to call and contact. And I want you to explain what people can expect the first time contacting the Nurses Guild. Like, do you guys have to have a representative come out, or does a nurse automatically come out to assess the situation before even setting up a contract or anything? Let our listeners know how things would go if they call or contact you guys.
We usually get an order from a hospital or a doctor.
Okay.
And then we contact the patient and we let them know about home care. We send a registered nurse out most of the time. Sometimes we'll send a physical therapist if it's going to be just a therapy only case.
Okay.
And we go through this big procedure with a lot of questions, and they look at the patient physically, see if there's anything else that they need. And we keep in touch with the doctor because we get orders throughout the period that we're seeing them. We let them know how long we're going to see them.
Okay.
Our nurses usually, if the patient has a problem, and they come for a visit maybe 2 or 3 times a week, depending on what it is. Sometimes it's an IV, then they might be there every day for a while.
Right.
Sometimes it's, wounds, so it might be a couple times a week. But it's explained to the family. We keep in touch with the family, the patient. People are also welcome to call our office if they have questions about home care, or if they're worried about someone, and they say, hey, I'm concerned about my family member. And then we have to have a doctor's order. We can't just,
It's not something that I could just like a plumber. You can't go to the yellow page and say, hey, I want a nurse to check on my dad.
Right. You have to, we have to have a doctor's order for home health.
Right.
But, we can talk with them on the phone. We could tell them how to do that, explain to them. A lot of them are like, oh, but, and now, well, it just changed in Florida, but a lot of doctors were doing telehealth visits where, like this, like talking, and the patient would say, okay, here's my arm. This is what's going on, blah, blah, blah. We were doing that for like a long time. Now we're pretty much, we have a doctor that can come out that does home visits. And a lot of agencies don't have that, but we have a doctor that is connected with us. Both
so he's an associate of it, but he's still...
Yeah, he's an associate, and we've worked with him for a long time, and he tells us, he goes to see the patients like on a monthly basis, and he sends us notes on what's going on, and we confer with him. But we also get like a lot of referrals from hospitals.
Right.
Which, people that just get out, they might have
We do IVs.
Yeah,
we do infusion of antibiotics, normally very short term.
Yeah.
We're not doing like infusions of neoplastic medications.
Right. Yeah, we're not doing that.
Cancer drugs. And wound care, we do wound care. For the medical, we do instruction on cardiac medications or pulmonary infections like pneumonia. So the medical, like say a person has a Foley catheter, which is a tube that the person has to urinate through into a bag. Well, we also take care of that as well.
Colostomy, stuff like that.
Yes.
We show the family. We try to find somebody to teach.
Right.
And sometimes people really want to do it. They really want to help their family, and sometimes they're scared.
It really is amazing. In my own head, I have right now, my grandfather was a very, very proud man. He served in the military, World War II and Korea. When he was done, he was a deputy sheriff for 26 years for the city of Philadelphia. He ran a youth organization called the United States Naval Sea Cadets, the Philadelphia Division. Throughout majority of that time, when his diabetes and his health slipped, it was such a hard thing to see for the man. But, I sit there thinking to myself, like, I remember there's a lot of things in this world that, like, you just sit there and go, oh, I don't want to do that. And I don't want to, like, put my late grandfather's business out there. But I remember when he got so bad, like, he would need help giving himself a fleet enema.
Yeah. Yeah.
And I remember, as much as that would gross me out if my best friend was like, dude, stick this up my rear end or whatever, but my grandfather asking me, it was not even a thought. It was like, absolutely, hand it to me and let me take care of it.
Right.
You know what I mean?
Well, it's the love of family.
Yeah. And it's, we see it a lot, and we also see the opposite too. We see families that, don't want to do it or don't want to. And it's sad when you see someone that doesn't have anyone. And that's why, too, psychiatry is very important to come in. It's important when that happens.
Yeah, so I imagine, like, as far as finding help, as sad as it is that there are some people that are like that, I got to imagine that majority of them are absolutely, like, lining up, like, what can I do?
Right. Well, that is. You get that a lot. A lot of times we have families that call our office here, and they're just distraught. They just don't know what to do. And, a lot of times what we'll do is we'll mention the social worker. or we'll mention, why don't we have, sometimes we can't even say we're going to send a psychiatric nurse out because people are like, oh, I'm not crazy.
Right.
You might have to say, well, we're going to send a nurse out to help you.
A feelings nurse often is what we say.
Or someone that you could,
which is really essentially what it is.
That's what we do.
Yeah, we work with feelings. Yeah. And that's what it is.
And it does help them. And, the thing that I think about a lot is that it's the patient's well-being and how they feel about themselves and what's going on with them as they age is so important. They need to talk about it. They're feeling loss, and our country needs to realize that. We have a lot of elderly here. Right. We need to let these people talk about how they're feeling, their losses, what's going on, and what we could do to help them. And home health does a lot of that because they get a connection with us. I haven't seen patients recently, but I have a patient, and Gretchen and I both saw her for like a long time, and she moved to Alabama. She can't even write, but she can, but it's tough. I sent her occupational therapist when I was seeing her. Right. She writes me letters till this day, and I haven't seen her in like probably almost 2 years. Writes me letters and sends me Christmas cards.
That's awesome.
So that's pretty much what you get out of this. It's a wonderful feeling to know that you've helped somebody. I know her whole family, and Gretchen does too, and she always goes, give me Gretchen's address so I could write her a letter. Practicing, for her writing. And it's a good thing.
That is awesome. Well, ladies, normally at this point of the show, at this portion of the show, I usually have my guests tell people where they can reach you. Obviously, I said that everything was in the description down below, but if you ladies would like to vocalize it out for the people about the Nurses Guild, now's the time to do so. Finalization, and let them know how they can get in contact with the Nurses Guild or get more information.
Okay, you could reach us easily by phone, and that would be 561-826-8937. Also, you could reach us through email, which is nursesguild, P as in Peter, B as in boy, @att.net. And in addition, do you want the address as well?
Sure, because surprisingly enough, I looked on anchor.fm earlier to see my where my podcast was going and being listened to. And obviously, in the top 3 in the United States, in the top 3, I'm mainly heard in California, surprisingly enough. Secondary is Pennsylvania, but third is Florida.
Yay! All right. Our address is 7700 Congress Avenue, and that would be Suite 1107, and Boca Raton, Florida 33487. And it is the Nurses Guild of the Palm Beaches.
And our other offices in Broward County, which is Lighthouse Point, which is by Pompano Beach and Fort Lauderdale. So we have quite a few patients there too. But whatever we could do to help families and patients, we're here for you.
Yes, absolutely.
I guess the final question, because my podcast does go worldwide, and obviously we unfortunately would not be able to help somebody in Indonesia for the sake of argument. But say somebody in Philadelphia hears this podcast and is interested in the Nursing Guild, but they're in Philadelphia. Is there any future plans of expansion, franchising?
Well, we always think about it. A lot of it depends, but we also can give people referrals. My husband and I have worked in Philadelphia many years. I do miss it, but most of my work there was hospitals. I did try to start psychiatric home care when I worked at one of the hospitals in Philly. Okay. And in those days, which was like early 90s, they were really worried about liability purposes with the nurses and stuff, because we were going to go into some areas they were concerned about. And I worked on a program and I tried to get it through, but it never went through. And then I moved to Florida. But we would give them, referrals there too, because there are home care agencies in all the states.
Right.
We just have a lot of home care because we have a lot of elderly. A lot of people retire here.
Right. No, that makes the most sense. Well, ladies, I thank you very much for coming on the show. Folks listening in, remember the description down below. You will find all the information if you find interest in the Nurses Guild, whether for referral in your own area or you have a family member that could be in need of these services. Please contact through the phone numbers or through the website down in the description below. I want to thank you very much for listening in. If you enjoyed this video, hit that thumbs up button, like, share, comment, subscribe. Check out all the other great podcasts of Realm of the Mist Entertainment. And, of course, for our audio listeners, we have you covered. Just look up Realm of the Mist Entertainment on Anchor.fm, Apple iTunes, Spotify, Pandora, iHeartRadio, or wherever quality podcasts can be heard. Again, we are proudly sponsored by the Nurses Guild, so you'll always get the information on every video we release. So even if this one you're not ready yet, by the next episode, you may be ready. The information will be right there at your fingertips. Again, I want to thank Lee and Gretchen for coming on. I thoroughly enjoyed this, and trust me, I'll have you back on because I got plenty more questions.
Okay. Thanks a lot for having us. We appreciate it.
Absolutely. And folks, I will catch you on the next Breaking the Fourth Wall. Have a good night.